what we're going to talk about is, what is arthritis? How do we manage it? How do we know we have it? How do we make the diagnosis? How do we manage it without having an operation? But if we have to have an operation like a knee replacement or a hip replacement, what's that all about? And what's new? What's new in 2018, 2019 that makes a difference? I will tell you that if you had a hip or knee replacement with me 6 years ago, the year I arrived, and you have your second one done now, you're going to find it to be a completely different experience. Same surgeon, same patient, your second knee or hip, different experience, simply because that much has changed in just 6 years. There's been more change in 6 years in my world than there was 30 years from the time I started. So that's pretty cool. I mean, that's stuff that's happening now. Really, really good. All right, arthritis. So let me ask you out, anybody can speak up. What is the cause of arthritis? Age. Wrong. Next. Wear and tear. Wrong. Next. What's the cause of the wear and tear is the definition. But what is it that's the cause of the wear and tear? Yes, ma'am? Genetics. 100% right. So if you say, my knees are worn out because I used to run marathons. My knees are worn out because I worked on concrete my whole life. My knees are worn out because I played football. My hips are worn out because. Wrong, 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 wrong. It's genetics. It's the gift from mom and dad to you. And you can't run away from it. It is what it is. So arthritis is a genetic disease. Can arthritis be made worse by certain things that you do or don't do? Of course. Absolutely. So what are some of those causes? Number one, smoking. What does smoke do? It puts carbon monoxide into your blood, replaces oxygen. Cartilage needs oxygen to survive. If oxygen is displaced by carbon monoxide, cartilage suffers. So smoking is one. Obesity is two. Other illnesses that are also genetic, that have to do with your immune system, can cause it, and so forth and so on. But it's a genetic disease. You don't come in and say, well, my knees are worn out because I played football. Now, if you had an injury your senior year in high school, your sophomore year in college, and you played pro ball and you had all kinds of cortisone injections to get you out on the field, now that's some acquired stuff that makes your knee, yes, a product of your sports. But it's a gift that you can't run away from. So you have to deal with it. It comes on in families at different ages. There are some people that have the onset of severe arthritis in their 50s. And there are families that I had up in Massachusetts where I saw the parents, I saw the sons, I saw the grandkids over a short period of time because their onset was early on in life, in their 40s and 50s. Both hips, both knees. So arthritis means inflammation of a joint. Arthra is joint, itis is inflammation of, and that's sort of the definition of what we're going to talk about today. All right? So arthritis means the cartilage, the cushion in your hip or your knee becomes gradually narrower, and we grade arthritis with a number scale. So 0 is a normal joint, and 4 is the highest number. So if you have stage 4, that means you have bone on bone, you have no cushion. All right? So if we look at a knee, so a normal knee would be the cartilage, the end of the bone would be covered with smooth white cartilage. And there's also the meniscus or the shock absorber between the two. Those are both what make your knee function well when you have 0 arthritis and therefore a stage 0. And then as the cartilage becomes thin, there's discoloration, there's fragmentation. Think of it as the nicely paved Sun City Boulevard, just been paved with asphalt, versus a cobblestone street in downtown Savannah. That's the difference between a stage 0 and a stage 3 or 4. All right? Is that clear so far? Just that definition of arthritis? Yes, sir. Okay, so it's really a cartilage disease. Now, what is it about cartilage that's so unique? There's one tissue in the human body, in mammal bodies, that does not have a blood supply. Cartilage. Take a piece of cartilage, look under the microscope, no blood vessels, 0. Other tissue is like that. And so it gets its nourishment from the fluid that bathes the joint, combined with what? So you need to have the joint with the fluid, and the joint has to move. If you take away movement, the cartilage dies. So when I was a resident in Boston back in the 70s, when someone broke their femur, they were in bed in traction with a pin through their knee, weights over the foot of the bed. They'd stay in the hospital for 6 weeks, 8 weeks. All right, and they didn't move their knee or their hip. The fracture healed beautifully. The cartilage in the knee and the hip died. So we now see people who said, you know, why is it just my right knee and my right hip? Because you had the femur fracture, you were lying in bed for 6 weeks. So we learned from that motion is critical to keep cartilage healthy. All right? So when you come to see me, and we'll talk about how we evaluate you with your knee or your hip, I'm going to tell you that the cornerstone of what you need to do, whether you have arthritis or not, is to move. And if you're not moving, you're just killing yourself, killing your cartilage. So this is an ingrowth bottom of a knee replacement. It weighs virtually nothing. And there's a textured surface on it, and you can see where the bone grows into this. This literally gets hammered into the tibia, the lower side of the knee. And there's enough immediate grip that I can pick the whole leg up. No cement. I've just driven it into place. I can literally pick the weight of the leg up and not have it pull away. So it's immediately secure. And then as soon as we let the tourniquet down and let the blood supply come back into the knee after the 23 minutes it takes to install the knee, it starts to grow into the metal. It's unbelievable. So you can pass that around. It's kind of it's titanium, very lightweight. So hip ingrowth stuff looks similar. It's a rough coating into which a bone grows. Yes, ma'am.
I have an opinion on those custom CAD drafts.
Yes. So that's a good, yeah. So robotics. You're talking about robotics in a way. So there's custom-made implants, there's custom-made guides, and then there's robotic-assisted implants. And the one thing I can tell you for sure that makes robotics a keeper is if you do a partial replacement. Probably the only way to really do a well-done partial replacement is with a robotic assistant. And and again, Hilton Head, that's invested in our program, allowed us to bring robotics to this area, the first one to have the robot for partial replacements. Is it going to be a help to use the robot for total knees? I'm not convinced. The meniscus is that C-shaped shock absorber. So here's a normal knee, femur, patella, tibia, cartilage over the end of the bone. The meniscus is the C-shaped shock absorber. There's one that comes in from the outside, one from the inside. Those are called the meniscus, all right? And they are made of not articular cartilage, but fibrocartilage, a different kind of cartilage. It has scar tissue in it, all right? And if you had I had an arthroscopic procedure done when I was in college. I had a torn cartilage. It was a torn meniscus, okay? So here's a common scenario. I have somebody who's 72 years old. They never had knee pain before. They call their very busy primary care physician and say, my knee really hurts, it's swollen. I was playing tennis, I can't play. Let's get an MRI. Okay, first reaction, get an MRI. Don't have to really see you, we just order it. It's paid for by your insurance, hopefully. If you don't have my insurance, it's paid for. And the MRI says torn lateral meniscus, torn medial meniscus. You come in with your MRI and say, I have a torn meniscus. Did you ever have an x-ray? No. So the sequence should be a standing x-ray of your knee. And 90% of the MRIs of the knees that I look at, I don't need to look at because they don't help me. The x-ray is what tells me. So the meniscus is often torn if you have arthritis. It's part of what happens. It gets frayed. It gets torn in a fraying pattern. You know, a piece of fabric that's frayed has got a bunch of tears in it. Or you have a tear like that. That's what we call a tear. So the meniscus in the college-age kid is an important thing to deal with. I had a torn meniscus, and it's an easy thing to take care of. But as we get further on in life, as we get to the prime years that we all are in, the meniscus is less important in terms of whether it's torn or not. It's part of arthritis. So when we put in this knee replacement, the kneecap simply gets turned to the side, and the tendon is still connected. So I don't disconnect it, doesn't do this. It's still connected to the thigh muscle, which goes all the way up to your hip, so it gets turned to the side. So that, so that we can make the cuts that we want on the knee to put the covering over that's titanium. And that thing that's going around is this bottom piece, and then it's plastic in between. So replacements are a titanium plastic Oreo sandwich. Metal, separated by plastic, and then metal. That's plastic that goes against the metal.
Isn't that nifty? Look at that.
Isn't that nifty? Yeah. Yeah, so it's a retread. A knee is not a replacement. You still have your femur, your tibia, your patella, your ligament, your posterior cruciate ligament, but we're putting a new surface. So we call it a knee replacement, but it isn't. It's not a replacement. It's a retread. You still have your wheel, you still have your tire, put a new tread so that it moves smoothly. A hip replacement is a replacement. We take the ball, the bone that's worn cartilage, makes some specific cuts, and then an implant goes in with a new ceramic ball. So that is a replacement. Thank you. Go have fun. Okay.